Finishing it already. So my kids are big.
Okay.
We got a blackout at our job. We trying to go home, boo.
Everybody's saying they got that blackout right now.
We got a
Wow.
girl. I'm at work and they got a straight blackout. Nothing on. Nothing on
Wow.
but me. I'm the only thing on. Woo, woo, wah, wah.
Wow.
It's ugly. Of
You in
course,
LA. You right in LA, right?
LA. I'm born and raised. Boo.
Yeah.
Yeah, I'm in LA. I'm on Crenshaw and King in the hood.
Oh, and Kaiser.
Yes, I'm at
Oh,
Crenshaw.
okay.
Yeah, we got a blackout. That junk went out. I don't think the backup generator working.
Are you
Oh,
talking
wow.
about at work?
Yeah, yeah.
Oh, that's scary.
It is scary, but we ain't scared. We just ready to go.
Wow, feels like a big party here. Everybody came, huh?
Yeah, we happy. I
We
know.
can't miss this one.
You can't miss this one. That's right.
Can't miss this one.
Period, Shamina. Period. We tripping.
Mhm. Let's see that.
I'm gonna cut my camera off. It's glitching. It's irritating me.
Miss
Hey,
Sandy's
Lynette.
pretty face.
Lynette,
Okay, there we go.
What's cracking?
my computer do that too. Do you know why it's doing that?
I don't know. I think because our internet is weak. Is weak.
It'll go off and then I have to shut it off because it keep doing that.
Yeah, I can't. I can't look at myself like that. So hopefully, I'm just keeping the camera off. The power is out over here, baby.
18. So 23, 38, 2, 20, 18. Okay. All right. So let's get started on, listen, the quiz for reproduction. I hope that you guys can all do well. We went over it a couple of times. People stayed after class to go over it. So I hope that you guys can do really well. This is the end of the term. You only have, what, 3 tests left? This quiz, the final, and the ATI final, right? So it's coming up on the very, very end. Some of you are in the 70s, the high 70s, and you can still pull this out. So just work really hard. If you have any question, email me, any question at all, you know, about something. And we'll get you through this because I think all of you can get through to term 4 if you just really put some work in now. Okay. Let's see. Okay. All right. So let's go to reproductive quiz study guide. Okay. What's the purpose of a DNC? Anybody know what the purpose of a DNC is?
To clean your clean the you know, like not residue, but the insides.
Yeah, to clean the inside. So when we're doing that, we're kind of cleaning. I lost you. Hang on. Okay. So yeah, so a DNC is a scraping, right? So say you had a tumor or irregular bleeding in the uterus, right? So we're going to go and we're going to scrape a DNC, dilatation, dilate the cervix because it's closed normally. So we're going to dilate, dilatation, and cerclage, not cerclage, curettage. We're going to go and we're going to scrape it. That's what a curettage is. That's what a curette does. That's a type of instrument. A curette scrapes it. So if you had a miscarriage, you have an abnormal vaginal bleeding, we're going to open the cervix and we're going to scrape the endometrial lining of the uterus, right? So if you, the way to remember this is if you had a miscarriage, remember where the pregnancy is established in the uterus, it's in that endometrial lining. So when we do a D&C, we're scraping the endometrial lining. Does that help you remember that a little bit?
Yes.
Okay. What is a pap smear or pap test or Papa Nicolau test? I put all the names in there. So in case you see a question that says Papa Nicolau test, one student said, I never heard of a Papa Nicolau test. And I was like, oh, okay. So we changed the wording. So so I put them all here. Pap test, pap smear, Papa Nicolau test, all the same thing. Why do we use it?
It's a diagnostic used to detect cervical cancer.
Cervical cancer, exactly. And what position is a patient in a pap test usually in?
Lithotomy.
Mm-hmm. Right, they're on their back with their knees up. Right before they're going to go do that pap test, what do you think the nurse has the patient do?
Void.
Void, empty your bladder, right? We want your bladder empty so we can have a good smear, right? If the bladder is full, it might push the cervix back a little bit. So we have them empty their bladder right before they do the pap smear. We go in and we take the tissue that's kind of shredded tissue that's shedding off. And that's what a pap smear is. And we send that pap smear for Bethesda screening, right? And it's going to tell us suspicious, not suspicious, that crazy little staging that Bethesda done. But that's what a pap smear is. It's not for endometrial cancer. It's not for uterine cancer. It's not for ovarian cancer. It's for cervical cancer. All right, true or false? Mammogram is an X-ray.
True.
True. And what do we X-ray? What do we X-ray?
Breast.
The breast. So we do the breast. We kind of do it flat, and then we do it from the side. So we have two views: side view and top down. Okay. Anybody remember what a Rubens test is?
To blow up the fallopian tubes.
Yes, ma'am. Blow up the fallopian tubes. And why are we blowing up the fallopian tubes?
To check to see if they are
Patent or open. Right?
Yeah, for patency, yes.
Yeah, we're checking to see if they're patent or open. Okay, so what do we use to blow up the uterus? I'm sorry, the fallopian tubes.
Carbon dioxide.
Carbon dioxide. And what kind of complaints might a patient have after a Rubens test?
Shoulder
pain, gas pains, right? Because they get that referred shoulder pain. That CO2 is irritating. Think about it. They go in your abdomen and then they blow it up with gas, right? You're going to feel miserable. And sometimes that gas can move around, get under your shoulder. And patients frequently complain of shoulder pain. I'm going to mute that just for a second. Okay, let me look at, hang on one second. Okay. So the next question is, what's a conization? Conization.
Oh, it's that cone shape, and they go in there and take a cone shaped piece of the tissue out.
Yeah, usually it's eroded tissue, but I'm going to give you a little hint on the question on the quiz tomorrow or whenever, because it doesn't say eroded or infected tissue. It just says taking a piece of cervix. Let me look at that back again. Hang on. I just want to make sure that you guys get this right. Removing a piece of cervix for examination. That's a conization. Because remember when we did the coldoscopy and the colposcopy, we went in and we're going to do an examination of the cervix, and we take a cone-shaped piece. So that's what a conization is. It's an exam where we're going to take a piece of, typically it's eroded tissue. On your quiz, it doesn't say eroded tissue. It just says taking a piece of the cervix, but that's called a conization. All right, what is a colposcopy? C-O-L-P-O.
Visualization of the cervix and vagina.
Yes, visualization of the cervix and the vagina. And why might we do a colposcopy?
check for like tumors and cancers in those areas.
Yeah, exactly. On the cervix. So we're the uterus and the vagina, we're going to look at that. Maybe there's some weird thing growing in the cervix of the uterus, and we're going to do a colposcopy. So maybe your D&C was abnormal. Maybe the patient went in, had a D&C, had a pap smear. The pap smear came back abnormal, right? The Bethesda staging system came back abnormal. Then they would go in and they would do a colposcopy to take a piece of tissue of the cervix. Okay? Pap smear, we're going to check for cervical cancer. You have your pap smear, it comes back abnormal. Now the doctor calls you and says, you know what, why don't you come back in? We need to check further. So they bring you in and they do a colposcopy, and they take some tissue, conization tissue, and send it to the lab. Okay, everybody good with that?
Mm-hmm.
What's a coldoscopy? What are we looking at?
Just examining the
Looking at the vagina and
uterus.
the right above the vagina. Is it the cervix?
It's the uterus pouch.
It's the
and
uterus.
pelvic area.
There we go.
Okay, so hang on. So a colposcopy examines the uterus and the vagina, right? Wait. Yeah, the vagina and the cervix, right? The colposcopy, the vagina and the cervix. The coldoscopy, I can't highlight it there, sorry. The coldoscopy is going to look at the uterus, the accessory organs, the fallopian tubes, and the ovaries. Remember? So the coldoscopy with the U, it does more. Okay. So let's see how we can remember those two. The coldoscopy has the U in it. So let's think that maybe the coldoscopy does the ultimate, right? The colposcopy with the O does the vagina and the cervix. Just does a little bit, just does that lower portion, the vagina and the cervix. Let's get a picture up here.
Okay.
Because you need to know these. So, okay, colposcopy with a P checks the vagina and the cervix. This is where the colposcopy, C-O-L, colposcopy. Patient's in has an abnormal pap smear. We're going to do a colposcopy, and so we're going to look in here and take a piece of tissue, maybe a conization. Everybody clear on that? That's the C-O-L-P-O oscopy. Okay. The coldoscopy with the U, let's say that does the ultimate. Let's remember the U is an ultimate. In the coldoscopy, we're looking at the uterus, we're looking at the fallopian tubes, we're looking at the ovaries. Does that help you remember that a little bit?
Mm-hmm.
Yes.
Yes.
All right. So, what's a laparoscopy? All these oscopies, remember, they have lighted scopes, and we look inside with lighted scopes. But what's a laparoscopy?
Examine the abdominal cavity.
Abdominal cavity, right. So we're going in through the abdomen. We put two rods in through the abdomen, make little nicks, one here, put the scopes in, and we're looking inside. So can you see the colon in there? Yes. John, yes. Can you see the colon in a coldoscopy or a colposcopy? No. Right. Okay. So the laparoscopy, we get to see everything. We get to see the uterus. We get to see the ovaries. We get to see the fallopian tubes. We even get to see the colon. Okay. So let's go through these three again. The colposcopy, C-O-L. We're looking at the vagina and the cervix. So you have an abnormal pap smear. They call you back. They're going to do a colposcopy. Okay. Then we go to coldoscopy, C-U-L. We said that U is going to remind us of what word?
Ultimate.
Ultimate. And what do we mean by ultimate?
You see the fallopian tubes, the ovaries.
We're going to see all of this, right? So we're going to see all of this, the fallopian tubes, the ovaries. And this is where we in the knee chest position, and we're going in through the posterior vaginal wall. Then we have the laparoscopy. And the laparoscopy goes through the abdomen and you can see everything. You can see all of this and the colon, okay? Anybody have any questions on the difference between those three? Everybody good? All right, everybody's gonna get those right. What tests are used in early detection of prostate cancer?
PSA.
PSA, rectal exam. And if those came back with a problem, what do you think the next, how would we determine if it is cancer? Because we know that PSA says, hey, let's look at the prostate, but it doesn't say it's cancer, right? It says, let's look at the prostate. So PSA tells us to go back. Now, what do you think they're going to do? Maybe they did the PSA and they did a rectal exam. What do you think that they're going to do next to diagnose the cancer?
A biopsy.
A biopsy, right? Exactly. All right. Well, I'm not sure how to answer this. What is the vagina, the cervix, the uterus, ovaries, fimbria? What the heck am I talking about?
Maybe you're talking about the definition of each or where they located.
Or maybe it's just the females, you know.
Yeah, it wouldn't be as easy as a female thing. So where's the vagina located?
Between the bladder and
Okay, between the bladder and the rectum, right? But it connects to the lower, it connects to the lower part of what? The vagina connects to the cervix,
yes, sir.
right? The cervix. Then this is the uterus, this whole thing, right? Oh, that's right. This is what we're talking about. This is the uterus. We have the top of the uterus, which is called the what?
Endometrium. No, the abdomen.
No,
I'm saying anything now.
this is the fundus. The top of the
Oh, the
uterus is the fundus. The bottom of the uterus is the cervix. And then what's the uterine lining? How many linings are in the uterus?
3.
Three. And what are they?
The endometrium, the myometrium, and the perimetrium.
Yep. And which one is the innermost lining? Where the
Endometrium.
endometrium. Okay. So the uterus has 3 parts to it. The uterus has 3 parts to it. The fundus, which is the top, then the mid corpus, and then the bottom is the cervix. 3 linings: endometrium, myometrium, perimetrium. The ovaries produce what?
Eggs.
Eggs, right? Eggs. If I said you were pregnant, where would the baby be implanted? Would it be in the vagina, the cervix, or the uterus? Hopefully.
The endometrium.
Endometrium in where? Where's the
The
endometrium?
uterus.
In the uterus. So if you're pregnant, our hope is that the baby implants in the uterus. We'll learn next week places that the babies implant and they end up, not surviving. But in the uterus is where the baby should implant. That's what we want. What are fimbria?
Finger-like structures that grabs the egg and brings it to the fallopian.
Yeah, and it's attached to the fallopian tubes, right? It's the finger-like structures that kind of pull it in when the person ovulates. When that egg drops, those fimbria kind of pull it into the fallopian tube. What are the fallopian tubes?
Your ducts.
They're the ducts, right? And then, so the egg drops, the fimbria pulls it in, it gets fertilized at the outer third of the fallopian tube. What's the outer third of the fallopian tube called?
Mhm.
The ampulla. Remember the ampulla? Remember, the egg drops here, the fimbria pull it in, they get to about here. In the meantime, the sperm are swimming, fighting, trying to get over here. And they fertilize in this outer third of the fallopian tube, which is called the ampulla. All right, so what are Bartholin's glands and Cowper's glands? What do they do?
Oh, they stimulate lubrication when
Lubrication, right, exactly. So the B and the C, right, the B and Bartholin's glands in the woman, Cowper's glands in the male. They're close by in the alphabet. I don't know if that helped you remember, but that's how I remember. They're close by in the alphabet and they lubricate. So the L is close to the C. So we're going to say all those beginning alphabet letters are for lubrication. Bartholin's, Cowper's, lubricate. Then we have the Skene's glands, the prostate gland, and mucus. So they're all at the other end of them. So the Skene's gland and the prostate gland secrete mucus, right? And they help, and the Skene's gland is in the female, the prostate gland is in the male, and they help with mucus. All right. Let's see. Ductus deferens. What's another word for ductus deferens?
Vas deferens.
Vas deferens. Where is 60% of the semen produced?
The semivesicles.
Seminal vesicles. Kiwi, you better get 100% on this test.
I better get 100. Ooh, Mr.
You better,
probably
because
don't
you're
know what's going
answering
on.
everything. Take your time. What's the
Okay.
18, what's that 18-inch tube that connects from the epididymis to the ejaculatory duct?
Urethra? Oh, no, epididymis.
No, anybody know the 18-inch tube? All right, so let's pull a picture up. We got this. What's this thing right here? See my mouse on this?
You can't hear me?
Oh, no, I can't hear anybody.
Vast difference.
That's
The
different.
vas deferens, right?
Yeah.
Yeah,
Mhm.
that's, no, I didn't hear you. I nobody was
I'm
answering.
sorry.
No, that's okay. So yes, the vas deferens is an 18-inch tube, and it connects the epididymis. The sperm comes up here, right? And it connects to the ejaculatory duct to go out the urethra. All right. Where are the final stages of maturation in the male for the sperm? Where is that done?
Testes.
Epididymis. The final stages of sperm maturation is in the epididymis. What do the testes do?
Produce sperm.
Produce sperm and produce testosterone, right?
Mhm.
What's the round donut shaped gland that provides mucus for the
The prostate.
alkaline fluid?
Prostate.
Alkaline fluid is the prostate, right? Are semen and sperm the same thing?
No.
No, semen is kind of the fluid medium, right? It helps, it connects with the sperm, so it moves through, right? The sperm are just little kind of tadpole looking things that are just going up, but that meets with the semen and it helps it flow through. So it's like a fluid medium. What produces 60% of the seminal fluid? Kiwi answered that. It was the seminal vesicles. Who remembers what dyspareunia is?
Painful intercourse.
Painful intercourse. What's PSA used for?
To check the prostate.
The energy.
Yeah, to check the prostate. It may tell us, look at the prostate, the PSA is high. It doesn't tell us it's cancer. If we think it's cancer, we're gonna have to do a biopsy. Linings of the uterus, we talked about endometrium, myometrium, perimetrium. Endometrium is the innermost lining where the fertilized egg implants, and that's in the lining of the uterus, the endometrial lining of the uterus. Position you're in for a pelvic exam, we answered that. What would you do if your pap smear was abnormal? We said this several times too.
Biopsy.
And how would we do, what test do we do to get that biopsy?
Pap smear.
No, pap smear is going to tell, pap smear is the pap. So that is the pap. So we got a positive result of the pap smear. What's the next thing we're going to do? Doctor's going to say, hey, you had abnormal results. I need to do a blank on you.
A D&C.
No, it's one of those three
It's the
things.
C, it's the C one, the first one, not
It's the
the
first
not the
one.
ultra,
That's right. It's the colposcopy.
the colposcopy.
So if your pap smear results are abnormal, your healthcare provider is going to call you and say, look, we had a little bit of abnormal results, could be nothing, but come in and we're going to do a test on you. And that test is going to be a colposcopy where they're going to go in, they're going to take a conization piece of tissue and they're going to send it to the lab. Everybody clear on that?
Yes.
All right. When do you perform a self-breast exam?
Once a
Sure.
month.
Once a month after your
7
menstrual
days
cycle.
after your period.
2 to 7 days after your period, once a month for the girl with menstrual periods. You could do it in the shower. You stand up, then you lay down on a bed, you feel around. Make sure we're doing under the arms, right? For a postmenopausal woman, she could still do it in the shower. She could still stand up, raise her arms, lay down, all the typical stuff, but she's going to pick a date, right? Because she doesn't have a period, so that she could do it 2 to 7 days after her period. If she's menopausal, she doesn't have a period. So she could say, I'll do it on my birthday every month. I'll do it on the first of the month. I'll do it on payday. Whatever it is, she can do that. Same thing with the testicular exam, right? In the shower, warm, soapy body, moving the testes around, feeling for any lumps or bumps. When do you do self-breast exams? Well, we just kind of did that. What should the patient do immediately prior? Okay, somebody answered this too. What do you do right before you get a pelvic exam or a pap smear?
Void.
Void, right, exactly. All right, that's it. I'm going to take you off share screen. I'm going to look at the exam, and I'm going to make sure we covered every single thing. Okay. 206. No, I'm just kidding. All right.
Abandon ship.
Right. Okay. All right. Make sure when you do the self-breast exam, you're putting enough pressure on your fingers and you're using the pads of your fingertips, right? Let me see.
Do you use your fingertips?
Pads of your fingers, pads. Hang on.
You said pads to your fingertips for what now?
Pads of your fingertips for self-breast exam. What does the ovary secrete again?
Eggs.
Eggs and estrogen and progesterone, right? So yeah, just like the testes produces sperm and testosterone, the ovaries produce eggs and also hormones, estrogen and progesterone. Okay. Okay, so we covered everything. The questions read the questions carefully because they're written a little bit differently than the way we speak. So just make sure you read them because everybody answered the questions right now. So everything you said, everything you said, and that, you would have gotten 100%. So just read the questions, take a second and make sure that you're reading the questions carefully, okay? All right. Anybody have any questions on that study guide? All right. If you don't, we're going to go on.